As a healthcare provider, you know that high-quality CPR is the foundation of pediatric advanced life support and should be practiced often by anyone who treats children. As we discussed earlier, patient survival depends more on effective CPR than on advanced treatment. Without effective CPR, PALS interventions will fail. You are now going to practice and be tested on your CPR skills. We'll start with giving high-quality compressions and breaths using a pocket mask. The 2010 AHA guidelines for CPR and ECC recommend a change in the BLS sequence of steps from ABC, airway, breaths, chest compressions, to CAB, chest compressions, airway, breaths, for adults, children, and infants. In the ABC sequence, chest compressions are often delayed while the rescuer opens the airway to give mouth-to-mouth breaths, gets a barrier device, or gathers and assembles ventilation equipment. By changing the sequence to CAB, rescuers can start chest compressions sooner, and the delay in giving breaths should be minimal, only the time required to deliver the first cycle of 30 chest compressions, or approximately 18 seconds. For two rescuer infant or child CPR, the delay will be even shorter. Another key change is the removal of look, listen, and feel for breathing from the assessment step. The healthcare provider should not delay activating the emergency response, but should check the victim for two things simultaneously: response and breathing, followed by a quick pulse check. With the new compression first sequence, CPR is performed if the child or infant victim is unresponsive and not breathing, or only gasping. Begin CPR with compressions. That's the CAB sequence. After the first set of chest compressions, open the airway and give 2 breaths. During this course, for any one rescuer activity, you will be using a pocket mask. When practicing multiple rescuer scenarios, you will always use a bag mask device. Let's take a look at one rescuer child compressions and ventilations using a pocket mask. Just watch now. You'll have a chance to practice momentarily. Put the heel of one hand on the lower part of the breastbone. Remember to push hard and push fast. Compress to a depth of at least 1/3 the depth of the chest, about 2 inches or 5 centimeters. After each compression, allow the chest to recoil completely. If you are unable to compress to the correct depth with one hand, either due to fatigue or lack of upper body strength, use 2 hands to provide ongoing high-quality compressions. After 30 compressions, do a head tilt chin lift and give 2 breaths, each over 1 second using a pocket mask. Make sure you can see the chest rise. Right now, your instructor will pause the video to allow you to get into position to practice all the steps in order.